Months now, we have been watching the spread of the monkeypox virus out of its typical endemic areas in Western Central Africa, with assurances that it's in no way going to pose a threat like COVID. Well, now the WHO has declared monkeypox a global health emergency. To find out how worried we should be, let's bring in a trusted voice that guided us through the COVID pandemic. Professor Salim Abdul Karim is director of CAPRISA, that's the Centre for the AIDS Programme of Research in South Africa. He's an epidemiologist and he serves on the WHO's Science Council. Prof, great to chat to you. It feels like old times. Hopefully better times, though, at this point. Tell me something. Why has the WHO declared monkeypox a global health emergency when it's been around for decades and there's a vaccine?
Well, it's quite a controversial call, and it comes from a backdrop of divisions within the committee that was given the task. So they have met 3 times, and on the 2 previous occasions were pretty unanimous that it doesn't warrant being declared a public health emergency of international concern. But at their latest meeting, there were people on both sides, and there are 2 reasons. One is that monkeypox is well known. We've had it around for many years. It doesn't spread very fast from person to person. It's been readily contained in Africa when there has been an outbreak. But on the other hand, we have a situation where we've got 16,000 cases, and we've got it in close on to 70 countries that have never reported monkeypox before. So I have to say, I would have also erred on the side of caution and declared it a public health emergency at this time.
Why has it moved into 70 countries? Is it mutating into something more dangerous?
So initially that was, everyone's reaction, that has the virus in some way changed its behavior? Is it now entering cells in a different way? Is it spreading in a different way? Well, it turns out that now that we've seen several of the sequences of the monkeypox virus, that it's exactly the same, or not exactly the same, but with minor changes. It's basically the same virus that we've always known. So it does not seem that it has mutated and that it is transmitting in any way differently from the past. What has happened is that it has now become a disease that's spreading in particularly vulnerable communities where individuals spend large amounts of time with each other, because that's how the virus spread. Remember that this is a virus that you're only infectious once you have the skin lesions. So you know that you are now a person with monkeypox and that you are infectious because it's evident. And the test to establish that the scabs and the lesions are monkeypox is quite straightforward. So the way in which the virus spreads is people have to have person-to-person contact for prolonged periods, in the same way smallpox used to spread before. And so the gay community has become particularly impacted, and that's across Europe, in the USA. The gay community has, because they spend large amounts of time person to person in a way that's leading to the spread. There's nothing about their sexual orientation that's involved. And in fact, it's quite damaging. People are stigmatizing that community. It just happens that that's how it's spreading. But it's beyond the men who have sex with men right now. It's occurring more broadly. We've even had cases now in children. So it is now becoming a more widespread condition.
Is it sexually transmitted?
So the virus itself is not. It's sexually associated in that people having sex spend a large amount of time with each other, touching each other. So that's the association, but it's not specifically in the way we would traditionally think about gonorrhea and so on. No, it's not in that same way.
Can it be transmitted through semen?
So the virus itself appears in many different body fluids. I can't answer that question directly because I haven't seen the latest data about this version of the monkeypox that's spreading now. But traditionally, it has not been associated with spread in multiple mucosal membranes. It can spread, for example, by coughing, but that's very rare. So even if it is present in semen, it would be very rare that it's spread in that way. Monkeypox is a disease that we have seen, it's endemic in about 10 African countries. They keep reporting cases, and they just readily control it simply with testing and isolating individuals. And that's how we've managed it in Africa without making it a big deal. But now the way it's spreading is a source of concern. And that's what we have to figure out now, is what's going on here. There's no treatment for this condition. We just treat it with antivirals empirically, but there's no specific treatment. The good thing is that there is a vaccine.
Yeah.
And the vaccine works quite well.
Yeah. So again, why the need for a health emergency? I mean, let's look at the death rate then of monkeypox, because if it's comparable to, say, measles, then surely there's no need for a health emergency. How does it compare death rate-wise to COVID, measles, swine flu?
Oh, monkeypox has a very low death rate in the 16,000 reported cases, much lower than those. So we've had 5 deaths in the 16,000 cases that we currently have reported. So it's a very mild condition. I think the principal issue in declaring it a public health emergency is that it means that the WHO international health regulations kick in. And that means that all countries now have to look for it. And they have to establish the testing capability. And within 24 hours of a case, WHO has to be notified. So that is important because it improves the data. Yeah. And it creates a coordinated approach.
Sorry to rush you, because I have one last very quick question. We, of course, are watching the clock like wild things, because we know that at 8 o'clock the president is going to be speaking. Aren't you glad you don't have to be involved in this particular State of the Nation address in any way? But one of the things that's been said is this is a knee-jerk reaction by the WHO, essentially a racist reaction, because no one really cared about monkeypox while it was still in Africa. You're from Africa. Do you think that that's a fair point to make? No,
I think the way in which the disease had been spreading in Africa, it really wasn't a source of concern. So there was no basis for it to be declared even a regional concern. I think we are dealing now where you haven't had this disease in 70 countries, and within a matter of, 8 weeks, it's now appeared in 70 countries. That means that we can't simply leave it to individual countries to do whatever they want. There has to be some coordination. There has to be at least every country establishing the laboratory capacity, doing the surveillance, reporting the cases, preparing to deal with it. Even if it never occurs in the other countries, 70 countries is a lot of countries. And so I'm a strong supporter of the need, when you're dealing with an infectious diseases, it doesn't recognize borders. It's better to have a national coordinated response and an international coordinated response.
Yeah, and it's certainly the last thing we want is to be caught napping after COVID-19. Thank you so much for chatting to us this evening. Professor Salim Abdul Karim, he's director of CAPRISA. Also, of course, he serves on the WHO's Science Council.